we have a problem. Inpatient services for children, for the most part, have been fronted up by doctors in training, particularly out of hours, and the number of those doctors is going down. We also don't have enough of those junior doctors. In the past, this problem has been solved by asking doctors to work more and more hours, but that's no longer acceptable. It's not acceptable to them, it's not acceptable for their training, and it's not acceptable for patient quality. We have to do something about it. In theory, the solution might be simply to recruit more and more junior doctors, but it's not reasonable to recruit doctors without any expectation they will progress from being a doctor in training to become a senior consultant. It's also not appropriate to have a complete reliance of service on doctors in training. It has to be different. The South Wales programme has been looking at these pressures, these same pressures that exist across the UK. And our conclusion is universally that our only solution is to reduce to a fewer number of regional centres while enhancing local services where possible. This will mean that the junior doctors that we have will be concentrated on fewer sites. There will be an adequate number of doctors in these rotas to ensure that there's a sufficient number of doctors in training to man a proper rota, which means that their training is maximised, that their opportunity to deliver patient care is maximised, and also the attractiveness of hospitals in Wales to doctors in training will be improved. At the moment, we have a problem with this as well. The Royal College of Paediatrics and Child Health has recently reviewed hospital services across the UK and has identified that something like a quarter of hospitals across the UK, only a quarter, have a consultant present at times of peak activity. The situation is no better in Wales. We have to do something about that. By making these changes, this situation will be rectified. We will have a consultant leading care with doctors in training on the shop floor at times of peak activity, 7 days a week. That should improve patient care. It should also improve the training opportunity for doctors in training, who after all will become the consultants, the specialists of tomorrow. No, most children don't need to come anywhere near a hospital. Most children are cared for locally. They're cared for locally now, and only a few children attend hospital with illnesses. Sometimes serious illnesses, but only a few of them. Most children have their care delivered by their GP, by community nurses, by community services, in outpatient departments, which have no reason to change. In fact, by making these changes, we would hope to improve the outpatient provision delivered by specialists, including, where required, rapid access clinics so patients can be seen at shorter notice, improving the local standard of care. But it is a reality, if we do have fewer regional centres, that some children, those patients who genuinely need hospital care, may have to travel somewhat further to access what we hope would be a better standard of care.